call.
All right, everybody, I'm going to jump in here and switch the order of things up a little bit because we have been joined by our Health Department Director, Rich Bullough. So to respect your time, Rich, I'm going to let you and Tom do our presentation and discussion first on vaccine distribution, and then we'll do any announcements, happy bucks, and everything after the presentation. Does that make sense for everybody?
Yeah, I'm a little caught off guard though. I thought Tom and I were going to sing a song. I didn't know it had anything to do with this.
It was the dance routine.
Yeah.
It was the dance routine that was hard to work out ahead of time. So I'll just start. You know, clearly, as probably folks have seen in the paper or on social media, the rollout of the vaccine. Well, let me approach it from this direction. The rollout of getting doses into arms has gone extremely well from the county's perspective, meaning that we are not wasting any vaccine or leaving any vaccine on the table that comes to Summit County. It is all being put into arms every week. What has been the challenge, and we've talked about this before, is how the priority groups have been rolled out. Specifically, and I think these were early decisions that the non-hospital healthcare folks, the school the first responders, and then the state added on the school districts. And given the flow of delivery of vaccines into the county, it's been a challenge to get through those priority groups, which we're not done with. And then with the added mandate of adding the 70+ population, which you know, in a lot of ways probably is the most at risk, that has added the challenge, as well as the registration system requiring email addresses and being difficult for some folks to navigate. So with all of that, vaccinations are still getting in arms and being used each week. And I think you're going to hear Rich talk about that. But we're certainly hearing from that 70+ population quite adamantly, you know, about how are they going to quickly get appointments and quickly get in the queue. And Rich is going to allude to this, but we are going to be making some changes later this week that will start that process. And over the next few weeks, the 70+ population will grow and grow as the higher priority to being the only priority until the next priority group is announced. And we don't know when that's going to happen, the next priority group, but it is probably going to be, based on past performance, it's probably going to be somewhat aggressive in order to try and get more vaccines to come to Utah, which is the biggest issue. They need more vaccines to come to Utah. So with that introduction, I want to again note that, you know, our folks at the health department, the hundreds of volunteers, both medical volunteers and regular folks that are helping with this effort, are doing a bang up job. We can ramp up immediately if we get more, and we will be able to do vaccination clinics every day, 12 hours a day, if we get the vaccines to support that. So with that, Rich.
Okay, thank you, Tom. I'll be relatively brief so that there's time for questions. First, for those of you who are on Facebook, I encourage you to either go to Dr. Michael Knight's Facebook page, he's a dentist in town, or go to my page, Richard Bullough, and take a look at the post that I shared that was posted by Dr. Knight about his experience in our drive-through vaccine clinic. you're part of Rotary for a lot of reasons, but part of it is because of the special place that we live and the people that you want to help here. And I think he captured something really powerful in his post, and I would encourage people to check that out. Our drive-through clinic is at the Utah Film Studio, as you've probably heard. The Lieutenant Governor and the head of the Utah Department of Health visited on Friday. I see Roger on the call, obviously Tom. Mayor Bierman was present. Importantly, Gary Crandall was present. And it was really a remarkable event in my view. We toured the point of distribution, the vaccine clinic, and then met and had conversations about gaps, communication, what we need, what help we need. And Mr. Crandall has agreed to allow us to use the film studio moving forward through March, with the possibility of extending that agreement. It is an awesome location. It's running without a hitch. Mr. Crandall proposed himself that to the Lieutenant Governor that we expand from 1 lane to 2 lanes, drive-through lanes. That would give us a sustainable capacity of administering about 600 doses a day. That's what we need to be doing. But that leads me to the crux of the issue, and that is a real severe shortage of vaccines. Again, we have the capacity right now to be doing 600 doses a day. We are receiving on average 400 a week. That is based on our census population. And I want to focus on a couple of issues. The governor early on identified teachers and staff and non-hospital medical providers as the top 2 priorities. And at 400 doses a week, which started out as 300 doses a week, I'm happy to say the last 2 weeks we've received 500 doses. But at that rate, we're still working our way through those populations. And that leaves the 70 plus population wondering, and when Tom mentioned that we're getting a lot of questions, wondering, where do I fit? And so we have made, Tom alluded to a few changes. One of those changes, the faculty and staff of schools and non-hospital medical providers, and I should mention, by the way, the hospitals were responsible for vaccinating their own providers. So we're kind of picking up the rest. But starting on Friday, there will be no further registration of appointments for those priority groups that I just mentioned. They have had an opportunity to get an appointment. The superintendents know about this. They are supportive. But moving forward, beginning Friday, appointments will be made available to the priority group of 70 plus. I just want to set some expectations though. We are currently, with those prior groups that I've mentioned, scheduled out through February. We are slotting in as best we can as many 70 plus as we can, but increasingly week over week, the 70 plus will become our focus. And my hope is that by end of February, first part of March, that population is exclusively our focus. We have requested from the Lieutenant Governor and from the state additional vaccines, specifically to focus on the 70 plus population, and especially to focus at the highest risk among that population. And we want to make a special effort for those that are homebound. We're reaching out as best we can through Meals on Wheels, faith-based organizations, and other partners to identify individuals that are 70 plus and homebound. And our intent is to go to them. And I believe we have the resource, the personnel to do that. Again, we just need the vaccines. As Tom mentioned, we're not sitting on vaccines. And in fact, we get a shipment on Monday. They're gone on Friday. And that brings up another important point. Over the Martin Luther King holiday, we did not hold a clinic on Monday, and we let the public know that. The reason we didn't is we were out of vaccines. It wasn't because we wanted a holiday, but that leads to the question that some of you might have. Why are we only holding 2 clinics a week? Again, we don't have the vaccines. We can deliver 300 a day right now without the second lane. And we are only again getting 400 to 500 a week. So,
Stop.
That really is where we are. Another thing that I want to address, and this is really important, we decided as a state to vaccinate, to not turn teachers away that worked in our counties. We made a public statement requesting that school district teachers and staff be vaccinated in their county of residence, but we did not turn anybody away. And that approach was consistent across the majority of the state. We are moving forward though, and that was really focused on medical providers and teachers. Moving forward, we want to focus on individuals that are living in Summit County, and living is a broad category. That can include people that are here as temporary workers. It can include second homeowners and others, but we want to limit it to individuals who have a Summit County address. So the whole point of this is we're honing in on that 70+ population. We're identifying the highest risk, and they will be prioritized. We're putting together a plan to reach those that are isolated. We're putting together a plan that provides access to public transit. And importantly, and Tom alluded to this, we are putting together resources and a process that is efficient to help individuals register. We've got a lot of people saying, why do I have to have an email to register? My husband and I, or my spouse and I, have only one email. How do we register the 2 of us with one email? We're working, in fact, we have a solution to that. A lot of these issues will become much more public moving forward as we actually begin to open large numbers of appointments for 70+. So with that, I hope that addresses your fundamental questions, but I'm open to any that you may have. I answered every question.
I have a question.
Okay.
I don't know, Rich, whether you were listening to the early part of this when I was describing how I'm kind of stuck in New Jersey. And I am in the age group that you described. So are you getting the 2-shot vaccine? In other words, I'd have to stay for 2 to 3 weeks in Utah and not be able to come back here. And the reason I ask is I have a family member here who is ill, and I really need to be here as much as I can. I'm also on the list in New Jersey, but I'm not sure I don't know what kind of ID they are taking. And so I'm not sure I'll be able to get the vaccine here, which you wouldn't know the answer to. But how is Summit County treating residency and the 2, and if I do get an appointment in Summit County and can't make it, but I'm still in that age group, can I re-register? Can I explain my situation to someone and then get kind of an ongoing deferred slot until it doesn't make any sense? I mean, I'm reasonably confident I'll be able to be back in Utah, hopefully by the end of March and the beginning of April. And at the rate you're going, you're not going to get to us until I think December or January of next year. So, and I kidding.
I sure hope that isn't true. I have made multiple requests for significant numbers of vaccines, and the numbers suggest if we look at census at residents, and we're going to have a bigger number than this. but we have somewhere in the ballpark of 3,500, 32 to 3,600, 70 plus in Summit County. Let's say even if we are 50% higher than that, if we can get not a huge jump in our doses, we can get through that population in 4 weeks. And so I am not anticipating dragging this thing out, and I don't want to set unrealistic expectations, but we're going to be aggressive in pursuing this. And I think the state is supportive of that approach. To answer your question, we are receiving the Moderna vaccine. We anticipate that is what we will continue receiving. That is a 2-dose vaccine. It becomes very challenging to provide 1 dose here and then, or have somebody come here just for the 2nd dose. Because the way this works is if we receive 500 doses, first doses on a Monday, about 3 weeks later, we receive 500 second doses that are dedicated to those 500 first doses. And when you start intermingling that, it becomes enormously complicated.
Right.
And so, Alex, and obviously you don't have a crystal ball, but if you can receive the vaccine in New Jersey and you're anticipating being there, first of all, if you have an option, the Pfizer vaccine is 21 days between doses. The Moderna is 28. So the Pfizer would provide you a shorter timeline to get both of those doses. Otherwise, I would delay and get both doses in Utah. So obviously,
if that happens, and I had an appointment scheduled that I couldn't make, would I be able to defer as opposed to going back into the general population? Because it is such an unknown. Obviously, I've got
Yeah.
a flight issue, and I am on the list in New Jersey, and I don't know. From what I've heard, they're pretty lax depending upon where you are on checking where you live.
Right. So I'm not doing the registering. So I would defer to not the people doing the registering, but I will ask that question of our nursing director, Derek Moss. And to be honest with you, we've not had the discussion. If somebody for extenuating circumstances has to reschedule, do they get priority? I will have that discussion.
Okay, thanks. I appreciate that.
Rich, I'd like to ask a question. It's Bob Richer.
You
I
bet.
realize you didn't set the priorities for any of these things, but when I first registered for my mother, my 91-year-old mother, I saw age and I went, oh, good, I'll put in 91. And of course, it doesn't let you do that. Is there any way in the system that you could let somebody know that you're dealing with a 90-plus-year-old? I guess I'm surprised they didn't, especially in Utah, where there are so many kind of super seniors, I'll call them. There's certainly a big difference between somebody who just turned 70 and somebody who's 91 years old. Is there any way to let the health department know that in my specific case with my mother, she's 91 years old and we'd like to get her a vaccine as soon as possible?
Yeah, actually, I can pass that information along to Derek Moss. So what you're referring to is not actually the registration process, it's the pre-registration process. The pre-registration, what was done there is we focused on coexisting conditions because that is the biggest predictor of risk. And so there was an opportunity there to list, do you have coexisting conditions? And that is, I mean, actually by far the biggest determinant of risk. When you actually go in to register for an appointment, it requires a birth date. And so we will have that information at that point in time. But you're describing exactly the scenario that we're seeing is there are younger people registering for much older people. Some of them are primary caregivers. And how do we juggle that? Our ideal scenario is that your mom and you would get the same date. You would come in and be vaccinated together, not have to do 2 trips. And that's one of the things that we're trying to juggle right now and figure out logistically how to achieve that. And that's for multiple reasons. It's both for convenience and it's both to mitigate risk. You know, if you're around your 91-year-old mother as a caregiver, or even partially as a caregiver, you also need to be protected.
Rich, we had a question from Thea in the chat about the freezers. Do you have the super duper low temperature freezers that are needed?
No, and actually, it's turning out to be a good thing. What has happened, we thought we had a low temperature freezer that was actually donated to us, an ultra low freezer from the Hansen Planetarium, and we cannot get it to stabilize. We've had multiple people come out and look at it, and the temps are too unstable. And so we don't dare risk a very valuable vaccine by not having it stabilized. That's turned out to not be a bad thing, because the health officers are coordinating among ourselves, and those health departments that have ultra cold capacity, and the two main ones are Davis County and Salt Lake County, they are receiving Pfizer vaccine and basically diverting the Moderna vaccine to the rest of us. And so that makes it, Moderna is a little more stable. It makes it a little easier for us to transport and administer, and it has a significantly more stable storage life. So we're receiving 100%. Brings up an important point, though. I just got off a call just minutes ago about the Johnson & Johnson vaccine. It is forecast to come online in March in large quantities. And it's a single dose vaccine, and it is quite stable. It can be transported, stored in a refrigerator versus a freezer. But because of those factors, we're relatively certain that almost all of the Johnson & Johnson will go to third-party providers, which will include physicians' offices, pharmacies, rural mobile units, and because it's just so much easier than the mRNA vaccines. I understand it and I support it. I'm a little disappointed. I was looking forward to the day when we'd have single dose vaccines that we could administer. But that may not happen. But what it does mean is CNS, Walgreens, and others who are currently receiving the 2-dose vaccines, all of those vaccines will come to local health departments, and probably some hospital providers, et cetera. But so we'll get more doses. We just probably won't receive the single dose vaccine.
Rich, this is Catherine Simas. I have a question.
Hi.
How are you going to slide in compromised immune system individuals who aren't 70 or older?
So unfortunately, you're not going to like this answer. And I've actually gotten the question quite a bit. As of now, so first of all, we're following the governor's order, and the state is identifying the priority groups. I have not, well, the conversations that I have heard is that they will be addressed as the general population, as we open to the general population. I'm not sure that's the right answer. So we're waiting. There are actually quite a few health officers and medical directors that are kind of questioning whether or not that's the right approach. We have advised the state of that view, but there isn't an answer at this point in time. I have not heard serious conversation about prioritizing specifically that group of people.
Thank you.
Hey, Rick, Hans Fuge here.
Hi.
I am pre-registered as not quite 70, but I'm getting there rather quickly. Do I need to re-register after that, or do I get moved up in the 70 plus category automatically?
So, you're not moving there any more quickly than the rest of us. It's still 24 hours every day, right? That's a joke. Sorry, not funny. Maybe you're just closer than the rest of us. You will. So you're saying you pre-registered but identified yourself as not yet being 70.
Right.
So I'm assuming that your birthday is coming up soon.
Correct.
Is that right?
Yep.
So when it's called onboarding, and So right now we have about 3,500 people who have pre-registered within the 70+ group. We have ranked those based on two things. One of them is risk, presence of coexisting conditions, and then also the date of pre-registration. So if you are within that group and you didn't provide a birthday, but you've already signed up for that group, when you go in, you get onboarded, you'll get an email. By the way, important message, you'll get an email that says CDC on it. It's legit. The invitation to sign up for an appointment doesn't come from the health department. It comes from CDC. And that's called onboarding. When you get that email, if you're 70, when you get that email, you're in. If you are not, you'll be bumped. And so, it depends on, I'm not going to ask you publicly when your birthday is, but it depends on when that date is. We are going to be increasingly onboarding moving through February into the first part of March.
Thanks.
Anything else? And I just want to remind folks, I'm available. If you don't think about a question here, the best thing to do is to call my office number, which automatically gets sent to my email. It's the easiest way for me to respond. The number is 435, direct office number 435-333-1582. And all of those voice messages come through my email, and I see those. So I'm always available, but does anybody have any additional questions right now?
I'd like to make a comment, Corey. There was a letter in the Park Record this weekend, I think, that talked about the county's dysfunction in getting vaccines out. And I have to tell you, the county is far ahead of just about every other county in the state, and probably way ahead of other states. And that's a credit to Tom and Rich and the entire EOC crew that's put this together. We have about 800 volunteers that have signed up to help facilitate that process. We were able to provide that information to the Lieutenant Governor. When she met with Summit County on Friday, she had met with every other health department in the state except for, I think, Wasatch was after us. And she was remarkably impressed with the system that we have here. And as Rich said, the capacity that this system has to accommodate more vaccines is substantial. The limit right now is vaccines, and the other limit, frankly, as Rich has said, is the governor's orders. So to the extent that you're circulating out there and you hear people beating up Rich Bullough and the health department for not providing vaccines on an efficient basis, that's simply not the case. And one of the things I'm actually hopeful of as well is that with the new administration in Washington, there could be a further shift in how this is done, with additional resources, with additional vaccines, with additional steps to try and make this process, to try and enlarge the process. So I know I'm a county council member singing the praises of a Summit County Health Department, but they have led in this effort from the very beginning of this pandemic all the way through vaccinations. They continue to do so. Rich very clearly made a plea to the Lieutenant Governor, as did Tom, please give us more vaccines. Don't hold us back, because there are some areas of the state that are using about 50% of their vaccines. Summit County is using 100% the week that they get them, and we're begging for more. So it's a credit to Rich, Tom, and the entire effort. And I'd like that recognized enough for them to get beaten up over it.
Rich, I have one quick last question to clarify what you said to Hans. I am 73 and pre-registered. Do I have to re-register as part of the next phase, or will that automatically roll over?
No, it rolls over. And what you're saying is you have pre-registered already. Right. So we have, right. Yes, no, you will receive an email from CDC, and that email will take you to a link. The site is called VAMS, Vaccine Administration Management System. And you'll have an opportunity to click on our site. There's a map, you click on the site, it'll take you through a process of actually getting an appointment, a date and a time, and a QR code for your vaccine.
Great, thanks.
So I do want to add one thing to Roger. I don't want to blow our own horn too much, but within about an hour of the departure of the Lieutenant Governor and the Executive Director of Utah Department of Health, I got text messages from both of them indicating that our visit was a highlight for them, and it demonstrated just what local health departments and counties can do. I'm very proud of what our community has accomplished so far.
And one last piece, credit where credit is due. We could not be doing what we're doing the way we're doing it without the generosity of the Park City Film Studio. They're making that facility available. It's a remarkable facility. And as Rich mentioned, unilaterally, without probing, Gary Crandall told the Lieutenant Governor that he was excited because they could expand to an additional lane of vaccines on that site. And he's committed, I think, I don't know whether a deal has been reached, but to a substantial extension of what they've already given for free. So please understand that, and please give credit to the people that are assisting this for the community good.
I'd also like to make sure that we're answering all the questions. So before we wrap up, if you're okay, Rich, there's a question about how we're doing, or what we're doing compares to what's going on in Wasatch County. Do you have some information about there?
So first of all, Wasatch County, they quit vaccinating individuals who didn't live there before we did. And I have pondered that decision. We proceeded with what we had agreed to as a state, and that was to vaccinate teachers that work here, independent of where they live. And so it is accurate to say that Summit County was able to begin to saturate or begin to reach, is a better word, the 70+ population before we have. But if you look at vaccinations per capita, there is only one county that exceeds Summit County right now, and that is San Juan County. And they have a small population, and they have the Utah Navajo Health System providing vaccines to the American Indians there. So Wasatch is doing an awesome job. And they, I don't have a single negative word to say. They are further along in vaccinating their 70+ population than we are right now. I guarantee you that we are going to catch up, and that we'll do very well with doing that.
I have a question that came to me regarding second doses. When you say we're receiving 400, are we holding half of those back for second doses, or how are you handling those?
So right now, what happens is let's just say we get 400 doses on a Monday. About 3 weeks to 3.5 weeks later, we receive another 400 doses that are linked to those first doses. And so we're accounting basically for 2 separate flows of vaccine. What we don't want to have happen, and it's happened in other parts of the country, including Florida, they have created almost a panic in parts of Florida because they have used second doses as primary doses, and they don't have vaccines to give as a second dose. And they've had people in line, and they've run out of vaccines, and they've closed the clinics and just left people basically stranded, many of them older adults. So we're managing those streams of vaccines really carefully. And kudos to Derek Moss and his team. I want to throw out another name that you may or may not know, Alyssa Mitchell. Alyssa is one of our health promotion people who has really dedicated herself to monitoring vaccines and registering people through this process. So, which actually brings up a really important point. We've got volunteers and we've got staff that are doing something entirely different than they've ever done before. And it's been pretty remarkable, pretty awesome to see. And this team, we're not to brag too much, but we're pretty darn good. this community has responded really in a remarkable way.
We have a question. When third-party providers start administering the vaccine, will they use our registration list, or will there be a separate registration?
That's a good question. What it's looking like right now, and again, the governor, not just our current governor, but our prior governor as well, they have the discretion to change direction on a dime, and they've done so. And so what I'm going to share with you right now is kind of the information of the moment. The proposal right now is that vaccines would still be channeled through local health departments, and the registration system would still be managed through local health departments. We would then issue a transfer of vaccine and a transfer of information to the third-party provider. I personally think that's a good thing. It certainly adds an additional load to our plate, but it allows us to know what's out there. An example of this, you may have heard that we vaccinated Elk Meadows long-term care facility. That was supposed to be done by Walgreens, and it didn't happen. We knew what was going on well enough to know there was a vulnerable population there that wasn't being vaccinated. We went out and vaccinated them. So I think it's important that the counties, the local governments remain the hub. But my philosophy is, and we shared this with the Lieutenant Governor, we welcome partnerships, and we've got a remarkable partnership in Intermountain Hospital, Park City, and obviously a great partnership with many community members. Yikes, I just looked at the chat. There's 13. Holy cow. I hope those aren't our questions. You're on mute, Corey.
Thank you. We have gone through most of them. There is one more I didn't catch.
Okay.
When the single dose vaccines are delivered to doctors and other healthcare providers in March, who will they give those doses to?
I don't know. I really don't know. And again, I don't want to set unrealistic expectations. We're being told March. I don't know that they're going to be available in physicians' offices and pharmacies in March. I really doubt it. The date that I've always kind of imagined is realistic is probably more like May for that. But again, Johnson & Johnson is saying they're going to have 100 million doses in March. We'll see. I don't know.
Okay, any other questions before we let Rich off the fish hook? No. Okay.
High
All
five,
right.
Bob.
Thank you very much.
You bet. And again, any questions, anything you need, just let me know. Okay.
I'll pass them on if we get them. Thank you very much.
Thank you.
All right.